Good afternoon, Marnie.
Good afternoon.
Marnie, you look much taller now.
Thank you. It's the magic of chairs.
I see.
Well, good afternoon, commissioners. Welcome back.
We are ready to go, Madam Chair, and I'll keep an eye out for Commissioner Rogers.
Thank you, Clerk Moss. Welcome to the afternoon section of the Tuesday, May 3rd, 2022 work session of the Washington County Board of Commissioners. This is Chair Catherine Harrington. I'm currently joined by Commissioner Pam Trees, Commissioner Jerry Willey, also our appointed Vice Chair, and Commissioner Nafisa Fai. We have one remaining topic on today's agenda. Staff is here to present recommendations on whether the county should withdraw from the franchise agreement for emergency ambulance services. And oh, there's Commissioner Rogers. Interesting. Okay. Just I want to make note that we have Chief Downey from the EMS Alliance, and earlier I saw a Chief Davis from VRFD, which I think is the Vernonia Rural Fire Department or Fire District. So anyway, I'll turn it over to Assistant County Administrator Marnie Kyle to introduce the topic and the rest of staff who are here to present for us today.
Great, thank you. Good afternoon, Chair Harrington and board. For the record, as Chair Harrington said, my name is Marnie Kyle. I'm one of the Assistant County Administrators. And I'm here today with you on this topic because I am also your representative on the EMS Alliance for this topic today. So today we are bringing to you the EMS Alliance and staff's recommendation about whether or not the board should withdraw from the current Metro West Ambulance franchise agreement. And so we're going to provide information about why we are making the recommendation that we do. I want to welcome Adrian Donner, the EMS office supervisor, Tim Case, who is our resident EMS expert, as well as Chief Downey, who is here today representing the Alliance, and he will speak to one or two of our slides, and the Alliance members are available to also answer questions from their perspective. So without taking up too much time, I'm going to turn it right over to Adrian, who's going to introduce the topic, and then we'll go to Tim and Chief Downey.
Thank you. Next slide, please. As Marnie said, we're here to discuss if the county, through a decision made by the Board of County Commissioners, wants to withdraw from the existing franchise agreement. This is the agenda. Marnie covered it fairly well as the speakers today. I will cover one more slide and then I will pass it off to Tim. So next slide now. So one of the things that was requested when we were reviewing slides was really to talk a little bit about some of the very similar sounding terms that we use through the presentation, just to ground people in the different components. We are looking at the emergency medical services system as a whole, which is made up of many parts that come together to respond and care for the people who have urgent medical needs. The franchise holder is one piece of that puzzle, and they provide the care and transport to the hospital. From there, we speak about the EMS program, and you see a variety of acronyms around that. We are responsible for managing the franchise agreement. We also support the work of the EMS Alliance. So our EMS Alliance, and we have Chief Downey here today with a number of members from the Alliance as well. They really represent the key system stakeholders who are working together to build the best system possible for Washington County. So these pieces all work together. With that, I'm going to pass the presentation off to Tim to give you some context and background that will help.
All right, thank you, Adrian. Next slide, please. And thank you to you, Chair Harrington, and commissioners. I'd like to first start by discussing a little bit of a brief EMS history in general and in Washington County while walking you through to present day and beyond. EMS concepts really can be traced at least back to the Civil War era. And anecdotally, in the late 1800s, New York City actually advertised for an ambulance surgeon and a quart of brandy for all of their patients. Fast forwarding from that time, in 1966, the National Academies of Science National Research Council published a paper titled "The Accidental Death and Disability, the Neglected Disease of Modern Society." This is frequently referred to as the EMS White Paper, and this document really sparked momentum and attention that would result in adding the Emergency Medical Services Systems Act of 1973 to the Public Health Service Act, which included the creation of 15 essential components of an EMS system. This EMS Act of 1973 also ignited focus on EMS systems development, design, funding, and it really created the foundation of what we live today. Since then, EMS began to really take shape through a patchwork of providers that were affiliated with entities such as hospitals, fire departments, and mortuary services. Looking more locally, in 1997, when Washington County entered into the current franchise agreement, EMS served a population of about 380,000 people with approximately 34,000 911 responses. Today, our system serves over 610,000 residents and responded to over 57,000 911 incidents in 2021. So since 1997 and the inception of the current franchise agreement, the county population has nearly doubled, which is a great thing because that means Washington County is a desirable place to live and work. But this also brings with it increased need of services, one of which is EMS. And as people move out of the urban centers and into more suburban and rural areas, a more sophisticated EMS system is needed. As this need for a more sophisticated system became ever more apparent, and those puzzle pieces that you saw on the previous slide didn't fit quite right together anymore, the EMS Advisory Council was formed to make operational and technical recommendations and to improve the delivery of EMS services. Additionally, in 2019, the Advisory Council gave way to the EMS Alliance through an ORS 190 agreement to enhance the safety and effectiveness of the EMS system through leadership, oversight, facilitation, and education. And really, the Alliance and its working groups work collaboratively and strategically to meet its mission. Next slide, please. So since the EMS Act of 1973, EMS systems really began to grow around the country. In 1996, just 1 year before the initiation of our current franchise agreement, the EMS Agenda for the Future was published. This document developed 14 EMS attributes, and among them were EMS research, legislation, regulation, prevention, and clinical care. These attributes, along with the EMS Act, help really shape our systems and things that we're doing again today. So since that time, scopes of practice and protocols have really expanded from just a few pages to comprehensive books, and they include such things as 12-lead EKG interpretation for heart attacks, multiple medications that can be used for the same complaint, and 2-step stroke screens. So EMS providers have really moved from a technician level to a clinician level, and this can be seen in current literature as they're being referred to as EMS clinicians. So along with this increased breadth and depth of knowledge for the clinicians, the technology has also expanded, which you can see a few of the examples on the screen here in the use of ultrasound, EKG transmission to waiting cath labs, and things like this, really kind of prepping us to have better outcomes for patient care. So moving forward again, published in 2019, the EMS Agenda 2050 takes the viewpoint of the patient at the center this time for system design to provide best possible outcomes. EMS systems are collaborative with community partners and an integral to regional systems of care that are data-driven, evidence-based, and safe. Even the American Ambulance Association notes that most EMS system definitions have been developed from the viewpoint of the system itself or from the viewpoint of the system service providers. By defining emergency ambulance services from the patient's viewpoint, however, performance results ensure that the patient is served first before any other interests. And really, this is the intersection we find ourselves at today. EMS as a medical field is moving forward really by leaps and bounds. And locally, we have an EMS system that has not seen real significant change in form or structure, along with an aging franchise agreement for ambulance transport that has seen only minor updates. This isn't to minimize the work that others have done to improve EMS care here in the county, but to emphasize that continued work is needed truly to modernize our system. Next slide, please. So as mentioned previously, we're moving into a more data-driven design to facilitate development of shared operational and clinical standards, emerging initiatives. Sorry, you can hear that packages were just delivered to my house, and our ferocious dog is protecting us. So we're really developing this data-driven design for shared operational clinical standards, emerging initiatives, and enhancements, some of which you can see listed here. Things like centralized dispatch of all EMS units using standard technologies, integrated deployment models to allow for scalability and flexibility, centralized medical direction for all system EMS clinicians to really provide uniform training, credentialing, and treatment standards, and more heavily weighted clinical metrics versus the response time metrics. So really, this is a whole system that we're attempting to create here and further build. And the emergency ambulance transport provider is a component of that design. And redesigning the system is not to put the full burden of system elements on the ambulance vendor, but to harness the talent of all system providers. A clean slate would really allow for this system to be rebuilt from the top down and the ground up to really build a patient-centered system that would value the 6 pillars of the EMS Agenda 2050, as well as provide clinical excellence, response reliability, economic efficiency, and customer satisfaction. And with that, I'm going to pass to Chief Downey.
Good afternoon, Chair Harrington and Commissioners. I am David Downey. I'm the current chair of the EMS Alliance. And with me here today are fellow Alliance governing board members and stakeholders. The Washington County EMS Alliance was formed via an intergovernmental agreement in 2019. And the current Alliance governing board members, affiliate members, and stakeholder groups are shown here on this slide. The mission of the Washington County EMS Alliance is to maintain and enhance a safe and effective EMS system through leadership, oversight, facilitation, and education of the EMS community we serve. We are guided by our foundational principles, which are in part an integrated EMS system based on collaborative public-private partnership, transparency and accountability, clinical excellence, and operational effectiveness. And these founding principles were adopted by the board back in 2017. Earlier this year, the EMS Alliance adopted a new strategic plan. The strategic plan has had input from all EMS stakeholders in Washington County, including the fire agencies, Washington County's EMS office, WACA, and our medical directors. Our strategic plan vision is to provide a high-performance, patient-centric healthcare system with an adjust culture through improved resource utilization, expanded education, system development, and collaboration. The plan contains 6 specific goals that we strive to achieve over the next several years. These goals include centralized dispatch, a resource management integration, data performance and metrics that identify quality improvement processes that ensure access to care for all, system enhancements, financial stewardship, and medical direction. As Tim has described the history of EMS and has noted, there have been a few adjustments made to the current franchise agreement over the last few years. The franchise agreement has largely remained unchanged. Currently, small changes to the franchise agreement can be agreed to by Washington County EMS office and the franchisee. Systemic changes cannot be made unless there is a negotiated agreement between both parties. The system does not need a renegotiation of portions of an existing evergreen franchise agreement. The system needs a fresh start. The current franchise agreement is a barrier to the changes all EMS stakeholders agree are needed. At its March 30, 2022 meeting, the first response agency representatives of EMS Alliance Governing Board unanimously approved a motion to recommend to the Board of Commissioners that Washington County withdraw from the current franchise agreement. The Alliance believes now is the right time, rather than continuing to make amendments to the existing franchise agreement or taking a wait and see approach during the current 18-month review period that began on January 1st and would end on June 30th, 2023. If a second failure to meet performance expectations were to occur, the revocation process would then begin. The Alliance recommends the Board of Commissioners withdraw from the current franchise agreement and authorize the beginning of an RFP process that would result in the award of a new emergency ambulances franchise agreement to a private provider. The EMS Alliance also wants to make clear is not recommending a change in provider. The current provider is in the same position as the EMS Alliance in Washington County in its efforts to improve the system. We seek a change in the system for which the best means is withdrawal from the current franchise agreement, thereby creating the opportunity to establish a new franchise agreement, one that incorporates agreed upon strategic plan elements that can adapt to system challenges and meet the demands of emergency medical services and public health community needs. The EMS Alliance understands the significance of its recommendation. Changes to the EMS system are possible and will be positive. We respectfully ask for the board's support. Thank you.
And I'll pick up from there. This is the right slide. The EMS program also concurs with the recommendation from the EMS Alliance Governing Board and with a recommendation to withdraw from the current franchise agreement at the end of the current 18-month period, which ends June 30th of 2023. Next slide. There are strengths and concerns in this recommendation, and I think it's fair to highlight both of them. The strengths have been highlighted already in that it creates a clean slate for creating the system that is being envisioned. It also, with that clean slate, gives us the ability to implement more sweeping changes. There are concerns. Our timeline is tight, and we would need to move quickly to get an RFP created and a process developed to find the franchisee that will work best within the new system concerns. And of course, with any process where you open up an RFP, you never know who the final vendor will be. So there's always that unknown component, which can be a concern. Next slide, please. And then finally, the action steps that I bring before you today really are the question to you, the board, if we can bring this item to you for an action item on May 17th. And then I would give an open question of, are there pieces of information that you would like added to this presentation if we come back on the 17th that would help you in your decision? And that's the end of our presentation.
Board members, at this juncture, do you have any questions with regard to what the recommendation is to us from both the EMS Alliance and our Washington County Emergency Management Services Office, as well as the next steps moving forward. So I think I first saw, well, it doesn't matter now, on my screen, both Commissioner Rogers and Commissioner Fye have their hands raised. So why don't we go in that order?
Okay, I'll go first for sorry, it gets confusing. Thank you, Chair Harrington. I wanted to say and extend my gratitude to the staff of all the education that Adrian, Tim, Marnie, and the whole team provided to me about this issue. I think I've had a lot of meetings with you all, and I've learned a lot, and I really trust the work and the efforts that you put in into this issue. And I know that you didn't take it lightly to come to this position, and I really appreciate your hard work. And in terms of answering your questions, I do support this decision, and I wanted to just let you all know that I do support the staff's recommendation on this to withdraw, and I'm in support of moving forward with May 17. I hope that's not too, I would say this, but I'm pretty sure it's not, because you thought about it, because you're the one asking for May 17. Hopefully it's not too much of a quick notice, but I'm in support. And I don't think I have any additional information that I need. I think with the multiple meetings that I've had with you, I think you've answered all the questions that I had. And also, I trust this decision because, Marnie, you're part of the Alliance, and the whole team really looked into this information. So I'm in support. That's what I wanted to say. And Chair Harrington, I will be going off camera quickly here. So, but I will be on the phone.
Thank you, Commissioner Fye. Commissioner Rogers, how about you?
Yeah, I don't take exception to the work. Obviously, we've got a lot of folks who have a lot of capability who've looked at this, but this isn't always the ideal time, or right now is not the ideal time to try to find vendors for a lot of things. What happens if, one, we don't get any proposals, or two, it takes longer than we thought it was going to take to come to some conclusion, meaning that we must have some provisions. If on May 17th we said, sure, go forward, our current vendor says, well, I guess you've terminated my contract, there must be some, Marnie, something that would bridge that gap between now and next year, I presume. And I also assume that what if we didn't get any proposals? I think that may be far-fetched, but I've been seeing it lately. Like, people just don't have the staffing to do this kind of stuff. So what happens in that case? Or if let's say the proposal we do get, let's say we get a couple of them, are much, much higher than our current contract, do we have the ability to go back and negotiate again? I'm just thinking of all of the mechanics of what might happen. So those are my questions.
Thank you, Commissioner Rogers. And those are good questions. We have a lot of pieces in place, including the strategic plan and a system redesign work group already standing up that will help us move through the process quickly, but with really valuable feedback and engagement from the system. Part of the work that the EMS program did in preparation for making a recommendation one way or the other was to do some assessment of if there are vendors out there who would go for this RFP, as that was one of our concerns as well. Our understanding is that there are vendors out there who would go for a competitive RFP, so more than one vendor submitting responses.
Thanks. That's part of the answer. How about the rest? What happens? I mean, our current vendor can't just drop us, I presume, on the issuance. If we say we're going to do this on May 17th, going to have to fulfill a contract.
Yeah, part of the franchise agreement includes a clause where they are required to provide the same level of service through the entire 18-month agreement. So that will go until June 30th of 2023.
And you're certain, I'm just thinking it through, you're certain that we're going to get more than one proposal, which is good. And you're certain that the vendor would have the same level of due care because that's the contract. And if the contract with whomever it might be is not able to be consummated by June of next year, I mean, that might be far-fetched. Do we have provisions to carry on so that any interim periods would be covered? And then also, I guess it wouldn't preclude us from going back to the current vendor if we got proposals that were a lot higher. We could always go back and negotiate. I think I'm just trying to think of the mechanics of this. I guess Adrian's answering these things.
Yeah, we have a number of options. We've actually implemented some mutual aid options in the last few months. So we do have the ability to work with our partners as we've had some need through the COVID event to do that. And then we have provisions within the contract to use, kind of as you said, if the worst thing happens, we have some provisions that we can do to keep services running.
Okay, Commissioner Willie, the floor is yours.
Well, I have a variety of questions. So currently the governing board that's on slide 7, are any of those organizations qualified and will apply for this EMS new contract?
Most of them are represented in the room right now. A number are qualified. My understanding is that they're not interested in doing the franchise agreement.
Okay. You and I talked when you and Tim briefed me about the time concerns about being able to pull this IGA together and get the or the RFP together and actually get this done efficiently and accurately by June 30th. And so I was hearing Roy ask the question of what if? I mean, is 12 months too tight? And if it is, do we have a plan B? Because again, we're kind of reinventing the wheel here, and it's significant. We want to do it right. So is the timeline too tight to give you that degree of comfort?
So, Commissioner Willie, this is Marnie. Thank you for the question, and I'm kind of jumping in, but Adrian and Tim can jump in, or Chief Downey is the Alliance spokesperson. But one of the things that gives us a lot of confidence since we first gave notice that we were going to consider withdrawal from the contract is that the EMS Alliance has really stood up and said, we will provide resources to help you research, to help you with the franchise agreement, to really step up and work as a system so that it's not just Tim and Adrian. So they also, as Adrian have said, they have been pretty clear that you know, are they willing to do more transport? Maybe. Do they want to be the franchise holder? You know, they're on the line with us. I can't see them right now, but maybe they can answer that if it would be good to hear from them directly. But what we've heard is that they're not interested in being the franchise holder, and they have their hand up. So, but I think what gives me the most confidence that this is a lot of work and the timeline is short, but we have a lot of commitment from all of the EMS Alliance, including the affiliate members, to make sure that this happens and that it happens well. So that's just what I wanted to add, but it looks like Chief Downey has his hand up, if that's okay to hear from them directly.
And if I could clarify, Chief Downey is here as a part of your topic presentation, but if other members in that conference room are going to speak, then we need everyone in that conference room to introduce themselves and get on the record. And have you manage that discussion?
Thank you. And I think we've agreed that he's Chief Downey, as the chair of the Alliance, is our spokesperson.
Thank you. Yeah, I am the spokesperson for the presentation. However, some of the questions you're specifically answering, I think, would be best answered by all of us perhaps in the room. So at Chair Harrington has requested, we can go around the room quickly, and everybody that's here in the Alliance can put themselves on the records in attendance. So we'll start with Chief Lynch.
Rodney Lynch, Chief of Banks Fire.
Steve Bowie, Tualatin Valley Fire.
Kristen Chaffee, Tualatin Valley Fire, representing Chief Weiss.
Greg Espinoza from Hillsborough Fire Rescue.
Jennifer Reese with WACA.
Mark Buckles, the Director of WACA.
Patrick Weinman with Forest Grove and Cornelius Fire. I'm also your Vice Chair for the EMS Alliance.
You want to talk about the public safety net and the framework?
Yes, Chair. This is Steve Bowie. I'm acting for Chief Weiss today as a member of the Alliance. I was going to just address the one portion of the question that the Commissioner had on the what ifs, the backup plans, and the plans B. First, we're very confident as your Alliance team that has been working on a strategic plan for a redesign of the system for actually months, that we have a very good runway of progress on that end product and deliverable that we'll need for an RFP. So I wanted to make that very clear. Second, on the public safety, what we call public safety net, your public fire agencies that are operating in the county have all been part of stepping up in emergency operations over the past several months to provide backup transport services for the county as the private vendor has struggled with staffing and other issues in order to be able to street enough units for the increased service demand that we're seeing. So we've looked at multiple plans and discussed with the EMS office and the EMS program management team on plan Bs and how we could come together as your public safety net in order to provide services during a gap of service where we'd have some type of catastrophic change in the private providers available to provide services through the length of the 18 months. So we have discussed that. We have tentative plans in place to where we could step up and do that as public agencies. So it is something that we definitely have been thinking about and working on strategically. And so that's what I would tell you is in kind of our back pocket and ready to go if we were to have that situation come up.
Okay. Am I still in the queue?
Floor is still yours, Commissioner Willie.
Thank you. So I'm just trying to connect a few of the dots here. You know, when we started down this path and made the decision back, I guess it was in January or something like that. I thought it was because Metro West was not meeting contractual expectations. And so we were being kind of driven to reevaluate the contract and open up for other providers. Now it seems like we are also transitioning to a significantly different service expectation for the new provider. So did one drive the other, or are we just being fortuitous, I guess, that we have the opportunity at this point in time to open up this for new providers? And oh, by the way, we're going to add a significant amount of expectations, new expectations on this provider. So I'm just trying to get the entire big picture connectivity from failure on Metro West part to where we want to be a year from now.
Yeah, thank you, Commissioner Willie. So I'll try to answer that. So I think we have been on a path of wanting to modernize and improve our EMS system for at least a couple of years since the Alliance was formed. And we have brought forward some changes to code, and we've been on a path to update our administrative rules. And we've talked about the ASA that we have to file with the state, and this franchise agreement. So we've brought forward the values and the principles that the Alliance put forth and this board adopted. So we've been on this path to modernize, and we got to a point where we understand that the changes to the franchise agreement in order to meet our goals of a modern EMS system are so significant that the only way to make those changes is to withdraw from the contract, completely redo the contract, and do an RFP. So that path we have been on for a couple of years, really. At the same time, about 6 months ago, as you know, Metro West began to have some significant performance issues. And so we brought the 18-month performance review to your board a couple of weeks ago. And that's a separate issue where based on their performance issue, based on our current franchise agreement, that language states that we cannot extend the contract another 18 months. So it really is, it's happening at similar times, but it's really two distinct processes that are not, one is not really influencing the other.
I guess where I was going with that, Marnie, and thank you for that. I was just saying that what if Metro West was meeting the criteria, all this for the last year, we'd be in a 4.5-year contract right now, wouldn't it? So wouldn't it be 4.5 years before we could actually make this transition, which is a little frustrating, I think, because I really like where we're going with this. It's just, did we kind of handcuff ourselves with this kind of a contractual arrangement, or would we have been able to make these changes even if Metro West was complying with the contract?
So I might get this. I mean, Brad maybe could be raised to answer this specifically, but the performance doesn't have to do with this timeline. The timeline was set because we brought to the board this idea of withdrawing from the contract so that we can modernize the contract. And then we have we had to do that within 6. Now I'm confusing myself, but we only had 6 months to do that. And Adrian or Tim, if you want to be more specific about that, but that timeline wasn't related to the performance issue. That's a separate issue.
Yeah,
Okay.
the timeline is set in the franchise agreement, regardless of the performance that the franchisee is currently providing. There's a number of ways to withdraw from the contract. The one we chose is outlined in the franchise agreement.
Okay, and just one more quick question then. We are significantly changing our EMS expectations, I guess. And I think I asked this of Tim when we met, but it would seem to me that the new provider is going to have to, maybe invest in new equipment and some new training and a variety of things. Am I accurate in that, or are we just so far behind the ball with our other contract that it's not going to be that big of a transition if we would change providers?
I don't know that it would be a huge change or overly burdensome task for a new provider. But it's one of those things where that would be kind of the baseline expectation as the vendor that's chosen in the RFP process comes in to bring these capabilities with them and to invest into the system to allow some of these capabilities to happen, rather than, as was mentioned earlier, try to negotiate with a current vendor on things that they may elect to do or may not. So I don't think it would be a tremendously burdensome task for a new provider to bring some of these capabilities with them.
Yeah, I guess what I was more focused on is, once again, the very short timeline we're talking about to do all of these things, and then making sure we give prospective providers the opportunity to, if they need to do any training or equipment or things like that, to have that available so they hit the ground running July 1. So it sounds to me like you've thought all this through, and I'm making it a bigger deal than it really is. So yeah, thanks for answering these questions, and I'll stop now. So go ahead, Chair.
Well, first I want to recognize Chief Downey indicated he had something to contribute in answering your questions.
Thank you, Chair. Commissioner Willie, specifically to your question about the contract and whether it's handcuffing the system, the answer to that question, the Alliance's opinion is yes. If we wanted to implement the number of changes we need to improve the system, the contract, regardless of the provider performance, is an obstacle to getting there.
Okay, thank you. I needed to hear that.
Commissioner Rogers, since you've spoken once already, I want to see if Commissioner Treese has any questions first.
Please.
I don't have questions. Thank you, Chair. But I'm very interested in the questions that others have. So thank you. Over to you, Commissioner Rogers.
Thank you. I think that Jerry's line of questions prompted me. I'm trying to get to understand this a little better. I'm not opposed to anything that's happening. Again, you all are experts, but with the new requirements and with the changes that you are suggesting, which I don't know what they all are, and I don't need to know that, but is it apt to drive costs significantly higher? All right, so the user of the system, and we have a lot of users, particularly down in my neck of the woods, we have a lot of users. Are we going to see spikes in costs so that we're going to be needing to explain what we did with this proposal? Or are things going to be, I know you don't know without the bid going on, but is it written in such a way that their costs are apt to go higher?
The RFP will have some to do with that. I can tell you now, our costs are around 30% lower than everyone else in the region. And while a consumer might benefit, financially from that, it hinders the ability of the system some because the rates are so low. So I would be remiss to say that I don't think that we would see some increase in costs at this point, just because we're so far below market at this point in time.
So just to clarify, because I know I'll get this question with a large senior population, we're probably going to see a spike. And are we as individual commissioners in our district, are we going to be answering those questions, or are we going to turn to our staff and this governing board to explain why it was written in such a way that those costs are going up? Because I don't mind explaining if I have adequate understanding of what's gone on. I just don't like people throwing a bill in front of me and saying my cost went up 45% and I'm not happy, and you all did it. And I guess I could send them over to to Chief Wise, but I don't do that kind of stuff. That's not nice to him. So I'm just trying to understand what we're looking at here.
So Commissioner Rogers, this is Marnie again, and I agree with Adrian. It's unlikely that we won't see some increase in cost, but we, as much as we're trying to focus on modernization. We also know that there is that separate issue of performance, and I think some of our low rates is contributing to some of that. So I think it's really important that the cost of the system and covering the needs of our residents, because what's more important is that we have when you call 911, you get the right level of care, and that someone is there and trained and has modern equipment and capability. That's what's most important. So I hope that it's not a spike. For the most part, Medicare, Medicaid, and private insurance does cover ambulance transports as well.
Okay, I'll finish up by saying, Marnie, I know you weren't here. I don't think anybody on this line was here when we last went through this, and I remember I wanted to make certain that we looked at the cost factors. And so back in the day, I voted to take a look at the transport being done by it was TV and FNR predominantly, who did want to transport at that time, and it would have been significantly lower. We didn't go that route, obviously. The commission voted to go to a private vendor, which is fine, and they've done a good job up until apparently now. But I'm a bit surprised that all of the vendors, the fire departments who were going to be vendors in the day now said we don't want to do it, and so our costs for our citizens, and that's all I'm looking out for, is some of my seniors. Going to be one to run the fire department, and I know they say, well, they don't pay for that. Yeah, they do through their levies, fire levies, and then they're going to run an ambulance out there too, and it's going to be very expensive. It's going to be an interesting set of conversations with a lot of people. So anyway, I'll stop. I won't ask anything more, but I think it's going to be a difficult conversation at some point.
Thank you, commissioners. My turn next. I'd like to start by just confirming a few things that I believe I've heard today. So the current emergency management service ambulance franchise and agreement started back in 1997, 35 years ago, if I'm doing my math correctly. So it sounds like I got that right. I've also heard today that in order to modernize the service, whether it's in terms of capability and or quality and other metrics, that the governing body, the Alliance, and our emergency management services office is recommending that we need a new setup in order to achieve that. Confirm? Yep. Okay. I've heard thank you, Marnie, for reminding us that the EMS Alliance is generally a new governing body, the bylaws, the things that you've mentioned already. I would like to note that you, Ms. Kyle, as well as Ms. Donner and Mr. Case, being closer to it and the work, I am assuming, well, I don't believe I have a level of familiarity with the strategic plan, which is fine. I'm just noting that I am relying upon your continued confidence and expertise involved in all of that. So I just wanted to note that, because I've heard mentions of the strategic plan and how that is enabling some of this work. So I think it's worth mentioning. So the current contract franchise agreement with Metro West ambulance. I understand that's off to the side. I just want to confirm that I believe through our prior actions that reverted to a 4-year contract. I got that right? Okay. Okay. Thank you.
4.5.
Oh, sorry, Brad. 4.5. Thank you very much.
Sure.
Good and definitive. I didn't expect my speaker to be that loud. Sorry, I jumped. You've got my attention. Thank you, sir. So really fundamentally, what my mind has not yet grasped yet through the course of today's presentation and conversation is, why 12 months? Could you run that by me again? Because the reason that I need you to take me through that again is because on one hand, I'm hearing we need this in order to achieve our goals, right? With a modern EMS system and a setup that will work for all that we hope to achieve. And in order to do that, we need to move forward. On the other hand, here are a whole bunch of reasons why we're at risk in doing it in 12 months. So I'm like, the board hasn't said do this in 12 months. So please explain that all to me again.
Yeah, the timeline is, within the current 18-month period. So leaving us with about 14 months to get it done. It's not insurmountable, but it is the timeline that we stepped onto in this process in January. So it just takes us through the next 18-month period.
So am I correct in understanding you have 14 months right now?
Yes.
Okay. Okay. I do want you to do it in a good fashion so that our public is served and the partnership that exists today and through the very powerful alliance continues to hold together. So I'm trying to make sure I understand the nuances here. Additionally, I have some questions around one RFP. And what's behind this is, I know what the current system is. I don't know what an improved system needs to look like, but I do hear very compelling reasons, right? Modernize, EMS 2.0, EMS 2050. We have an aging population, we have a growing population. I also know that we have multiple fire district services throughout all of Washington County. Some have variation on a theme, some are entirely separate for, say, a rural area versus city areas versus suburban areas and everything, every combination in between. So, and I do feel very confident that the EMS office through Washington County staff has very clear and distinct responsibilities as provided through the state. And that is in no doubt, right? And I know you'll do a good job of designing a new system that allows for good quality service, right? You've heard this from me before of, I look towards outcomes, right? So I want to see that there are those outcomes of modernize for a system that serves us now and into the future, that is flexible, given the various community types that we serve, is flexible for the changing demographics of our community. And, for all I know, if there's one or more fire districts that feels that they don't have the level of ambulance service that they want or need, they can contract with Metro West for all I know or care. I just want to make sure that our community gets the quality of service that they need, that costs are covered for that appropriately, and that the county will continue to meet its obligation per that state authority. Beyond that, I don't know if it's one RFP, a whole bunch of intergovernmental agreements, or whatever sort of construct. So I don't know enough today to say it's just one system with one provider versus a system where there are different providers that all have to come together to cover the whole geography, have one another's back in the case of mutual aid, things of that nature. So can you, I know I painted, it's not clear to me today, but I'm not knowledgeable enough to be able to recognize today that you need to move forward with just one RFP. Can you help me understand that?
Yeah, let me tackle as best I can the myriad questions in there. First, rest assured, if we come back on the 17th and the decision is to move forward toward an RFP, we come back to you with the RFP and with the process. So that's part of the agreement. You aren't cut out of the deal yet. You are stuck with us for a while. In addition, I think while, you can see Chief Downey named here, the powerhouse that is our EMS Alliance, as represented by the folks in the room, are a huge resource in all this work. As they said, our strategic planning, our working together for system redesign is happening at this hugely high level. And so that actually makes a lot of the time pressure piece feel more comfortable to me, because we already have the people at the table. They know each other. They're willing to get in a room together. And so that's really helpful as well. And so we'll be, taking their system redesign work that the representatives are all working on now. Pieces of that will go into the RFP. The RFP will come to the board. The process for evaluating the RFP will come to the board as well. So I hope that helps with some of the concerns as we move forward.
What it tells me is there's more to come about how this will work, right? And that's good. I appreciate that. Thank you very much. I feel that as one member of 5 on this board, you've satisfied my information needs to date over these last 3 years, and I have confidence that you will continue to help me understand the intricacies and the importance of this and deliver quality service for our community. One last thing I'd like to contribute. I had aging in-laws that lived in Clackamas County and were frequent users of the ambulance service over there. And I learned a lot about Medicare. Then they lived here in Washington County, and I have aging parents living in the state of New Hampshire, and I've learned a thing or two about ambulance service there and cost coverage and response. So I have no idea, but I'm hopeful that in modernizing the system, that all of our vendors will be able to take advantage of whatever Medicare, Medicaid coverage there is, so that our seniors particularly are not overburdened with increasing cost structures. But at the same time, as you've helped me understand in today's presentation, the ecosystem has changed from one that is at a clinician level to that of from a technician level to that of a clinician level. And I really appreciate how you covered that today. Is there the possibility that through this, I don't want to inappropriately use the word redesign or modernization, that's the word I should use, in this modern system that you'll all be working on, will it allow for the providers to take advantage of funding that perhaps they can't today in delivering that service?
To answer that question, yes. As we go through kind of the system modernization and looking at the RFP, there is a focus on economic stability and, does the service pencil out for the provider? So those funding streams that would be necessary for it to be financially sustainable for the vendor definitely are looked at and included as they are appropriate.
Thank you, because I think unlike Commissioner Rogers, I don't assume that our community members are going to experience an increase of cost as the quality of service and the expertise of the service expands as part of this modernization. So I know I am comfortable with your recommendation to move forward as well. I believe that Commissioner Treese is in alignment with that. Did we call on Commissioner Fye? Yes, she spoke first. She said she's in support of it. Commissioner Rogers and Commissioner Willie, do you want to weigh in? Because I'm not clear if you are ready to move forward.
I don't need to weigh in. I said, let's go forward, but I still probably have a disagreement in terms of cost increases. I don't see how you do that. I've been in the business world too long to say that you're going to increase all of these things, but there's not going to be some trickle down effect. I think I heard staff say there was. So I'm just preparing myself for that part of it. But and I'm also at some point would like to know from our staff. I'm hearing none of the fire folks are saying that they would transport, which is way different than I experienced the last go around. So if that's the case, then I guess it's a public, some kind of public company who do it. And I don't know whether it's going to be just RFP driven or cost driven and all that's going to work. But let's just go forth and see what we find out.
Yep. Yeah, sounds like it'll be very different than what you were faced with 35 years ago. Great. Go ahead, Commissioner Willie. Sorry, didn't mean to interrupt you.
No, that's okay. I would agree. I'm ready to move ahead too. What I always try and keep in mind is that this contract is a significant contract, and I thought I had heard the reimbursement rate right now was about $780 a trip. I don't know if that's true, and I don't even know where I got that. That's just the number rattling around in my head. But if that's the case, and there's 57,000 calls, that's a lot of money. And so we need to be very concerned about not only moving ahead on this, it's certainly a good idea what we're trying to do, but it's going to have a significant impact certainly on our local provider that's been with us a long time. So I'm just trying to balance all of these things out. But yes, I'm ready to go ahead.
All right, so when you bring this RFP forward to us, I have assumed that that will be in our business meeting on May 17th, or is that a work session?
So Chair Harrington, this is Marnie again. So on May 17th, is when you'll take formal action to withdraw from the contract and direct staff to bring an RFP. So that won't happen May 17th. That will happen probably a couple of months later, where we'll have the details of this is the RFP that we want to issue. But May 17th is just a formal action on today. So it'll be very similar to today. Only you'll be doing an action item. So you'll be taking a vote.
So one thing that I think would be helpful to hear on May 17th is, what is the target date by which you'll come to us with a proposal on proceeding with that RFP, as opposed to leaving our public with just the impression, okay, we're going to pull out of the contract and we have no clue yet what we're going to do, right? That's not what you're saying. So let's tell that story better.
Yes, thank you. We definitely will, and we're definitely not saying we're going to leave it hanging, but I just wanted to be clear that we're not bringing the RFP on May 17th.
Yep, I got it.
We do have a timeline that we will bring forward.
Terrific. Okay, go ahead, Commissioner Treese.
I just want to say thank you to Marnie, to the staff, to the legal staff, and also to the EMS Alliance. I know this has been a difficult and long process, and I really appreciate the work that's gone into this, and with the foresight of with looking to the future. How are we going to work into the future? And it's not lost on me the amount of effort that's been put into this. So thank you for that.
Okay, all 5 of us are on the journey with you. Anything to close?
No, just thank you for your time. And we are all available if you have questions in between, and we will share the EMS Alliance strategic plan with everyone. And also thank you so much to Chief Downey and all of the Alliance members for being on today and helping us with some of these great questions. It was great to have you here. So thank you.
Yes, let's go figure out a new modern system together. All righty. Well, that's it for topics for today's work session. Does leadership have anything to close or anything from commissioners today? Nope. Okay, seeing none, I'll adjourn today's work session of Tuesday, May 3rd, 2022. Thank you very much. Bye-bye.